Yes, we want to talk about family planning, and I'm sure this is one of the most interesting discussions you're going to have, whether you're single or whether you're married. There are several kinds of family planning, depending on the kind of person and what you'd want to do. The essence of family planning actually is to ensure that your children are well spaced so that you can adequately take care of them. So, for the father, it helps you to take care of your children well. For the mother, it helps you to take care of the current child you have, while you also satisfy your husband adequately. And it also helps that child to actually grow very, very well. So, family planning can be looked at in three categories, depending on how long you want to space your child. There's the short acting, that's for those people that want to space their child for less than 2 to 3 years. There's the long acting, which is beyond about 3 to 7 years. Then also there's the permanent family planning for those that actually do not want to give birth any longer. Okay, so I'll be discussing about 7 of them which are widely used, and I believe that since it's acceptable to most women, it's going to also be okay. Women and men, I'm sure you should be able to find one of them that will be okay for you if you're interested in family planning. The first 4 are actually used for those that don't want to space their children for a long time. The first is Lactational Amenorrhea method, which I'll talk about shortly. The second is the use of condoms. The third is the use of the pills, the oral contraceptive pills, and the fourth is actually the use of injections, okay, which could be 2 or 3 monthly. The next set of groups are those that want to space their children for a much longer time, probably between 3 and 7 years, and those they include majorly the implants, which are put within the arm, the high UCD, the intrauterine copper device, okay, or contraceptive device. Then finally, which is the 7th one, for those that want permanent contraception, we call it sterilization. For the males, vasectomy, and for the females, bilateral tubal ligation. So we start with the lactational amenorrhea method. Who is eligible? First, you have to be breastfeeding exclusively. That means that you are not giving water. Okay, that's very important. Secondly, your baby must be less than 6 months. Okay, so once your baby is more than 6 months, it's not going to work. And third is the fact that your menstruation must not have returned. What are the benefits of this? You can start it, just after childbirth. You don't need any money, you don't need any money to do it. It doesn't interfere with sex. But the disadvantages that it could have is usually, in some people actually see their menstruation earlier for the 6 months. There are people, it doesn't protect you against STIs, okay? And so those are some of the disadvantages that it could actually have. So next, condoms. Yes, this is one of the most popular contraceptives, and you should know that they are both male and female condom, even though the female condom is not as popular as the male condom. And what are the advantages of the condom? It's easier to wear. You don't need any medical person to wear it for you, you can actually do it by yourself. Another advantage, this is a major advantage, is that it provides dual protection. What do I mean? It protects you against unwanted pregnancy on one side, and on the other side, it protects you against sexually transmitted disease. What are the disadvantages? Well, it's not absolutely effective. Number 2 is that it requires your partner's cooperation. We are aware that not all men always want to use condom, and in certain cases, if it's not worn properly, there are times where it could burst and all that, and it also requires that there is an erection for it to operate very well. So thirdly, it's important we also know about the oral contraceptive pills, okay, that are usually taken daily. If you don't have breast cancer, or you don't have severe to moderate to severe hypertension or migraine or thrombosis, it means that you actually are eligible to use it. And the advantage is that it's easier to use. You just take a tablet every day. And the good thing is that usually for most people, when they discontinue it, they actually resume menstruation and they can actually give birth. The disadvantage is that you have to take it at the same time every day, and that could be a problem to certain people. And also, people can also forget about that they're supposed to use it at a particular time, and it doesn't also protect against sexual intercourse. Depending on the type, there are some, the combined, that you cannot use if you are breastfeeding. So it's important you notify your healthcare professional before you use the pills. So next is the injectable contraceptives, which could be for 2 months or 3 months, and it's also very, very effective. And if you don't have severe or moderate hypertension, you don't have migraine or deep venous thrombosis, or you don't have any unexplained vaginal bleeding, then you can actually be eligible for this. And the benefit is that there's a lot of privacy. Okay, so you don't. It's possible that nobody knows that you're actually using it, and you don't have to go use a drug at the same time every day. But the disadvantage also is the fact that it doesn't protect against STIs, which is important that you know. If it can also cause the menstruation to stop, and in other words, when you discontinue it, it may take a little while, probably 1 or 2 months before you resume fertility. But aside from that, it's also a very effective contraceptive. Yes, a lot of women are excited about this one I'm going to talk about now, which is implants. The beauty of implants is that it can last for about 3 to 5 years if you want to space your children, and it's also equally very, very effective. You don't, and it gives you some form of privacy, because I mean, you could just have it in your hand there. I mean, just underneath your hand, and nobody will know that you've had a contraceptive. As long as you don't have any cancer, liver or breast cancer, or you don't have heart disease or liver disease or deep venous thrombosis or any unexplained vaginal bleeding, it's something that you can actually consider. Okay. However, the disadvantage may be the fact that it doesn't protect against STI. It's important you understand that. You may have to use dual protection. It also it can stop menstruation just like the injectables, but usually most of the time menstruation will resume in just a short while. But another challenge some people have with it is the fact that you might need just a very minor operation, just a little cut on your skin and it's there. But for many people tolerate it easily without any problem. So I want to talk about the copper T, which is another one, which is actually the IUCD. Most women or people call it copper T, and copper T is very, very effective for prolonged spacing of children. Very effective for prolonged spacing of children, and most people can use it while breastfeeding, so it's that safe. And if you don't have any infection, sexually transmitted infection, or you don't have any unexplained vaginal bleeding, it's something that you can use. The disadvantage is, well, usually first it requires a skilled person to actually do it, so it's not something you can do yourself, or someone that is not skilled can do. Some women will respond initially with excessive bleedings, and infections and all that, but most of the times this corrects itself within a short period of time. And I can let you know that a lot of women are using the IUCD conveniently with little or no problems. So finally, it's the permanent contraception method. Okay, so there are some of us that are done with childbearing and you're not interested in having any more children. So why not just close it up finally? Okay, so for the male, it is called vasectomy. So there's a little pipe that takes spermatozoa from your testes and down to your urethra or your penis. That pipe is blocked at certain points, and of course that man can release spermatozoa. Okay. Then for the woman, it's called bilateral tube ligation. Okay, so there's a little pipe that takes the egg from the ovaries into the uterus. That's the womb. That pipe is blocked, and that eventually prevents a woman from getting pregnant. The good thing about this method is that it's a long-term contraception, so you have no fears, and any other thing. And it's usually very, very, very effective. It's very effective. And you're eligible if you don't plan to give birth any longer, and you don't have any thing that is against any problem or medical condition that is against that procedure, and you don't have any doubts, because it's important that's clear. You don't want to do it and later you think twice again. You must be well assured that you want to stop at that point. Okay. Disadvantages: well, it doesn't provide dual protection. So if you want to protect against STI, you may have to use condom, and it must be done by skilled surgical personnel. So I think this is how far we can take on all the contraceptive techniques. I'm sure after listening to this, you can discuss with family planning experts and your healthcare professionals and choose one. Let's control our population. Let's control the amount of children we have so that we can give our children and the society the best. Thank you.